Virginia Garcia was a 6-year-old migrant farm worker girl who came up from Mission, Texas. So Virginia Garcia cut her foot along the way, we think in California, and the cut in her foot became infected and soon became septic. And as a result of her and her family not having access to main healthcare services, she ended up dying at 6 years old right here in Washington County. Through that event, a small group of committed local community people got together and said, you know, this is not acceptable in our community. We need to do better. And from that was born the first Virginia Garcia Clinic. There are some core things that have remained as part of the Virginia Garcia story, namely our outreach to farm worker populations. We continue that tradition today, but we've integrated also services like dental and pharmacy, behavioral health and wellness activities to really respond to what are the needs today. So from that very early clinic, serving just a handful of people, has now grown to serve over 48,000 patients with comprehensive care annually.
The mission is what brought me here. The mission of Virginia Garcia described everything that I believe in as a physician. Here we're committed to meet people where they live and where they work. And one of the ways that we do that is by our mobile clinics. It allows me to be on the front lines and provide care to the people who are really needing it, but at the same time, it allows me the opportunity for advocacy. And I believe that as a physician, I have a responsibility to be an advocate and to be a voice for my patients. And so the foundation allows me to practice this advocacy in the larger community.
Who are the Virginia Garcias that I'm serving every day? I think it's important to work for an organization that has strong values and is committed to the mission. And that is really what drives me every day in the work that I do. When we graduate from pharmacy school, we take the oath of the pharmacist. And the first part of that oath says, I will consider the welfare of humanity and relief of suffering to be my primary concerns. And I really feel that working here at Virginia Garcia gives me the opportunity to live out that oath.
People who choose to work here at Virginia Garcia choose it for a very specific and very personal reason, as I've gotten to learn about people's stories, and those are for the same reasons that make Virginia Garcia special. Everyone has that one or two stories that really reflect that similar lineage, that history that Virginia Garcia had, except with a happy ending. And I think there's just a specific touch that everybody adds to the interactions they have with people that make it different and differentiate it from all the different systems, because yes, we use the same medical record systems and we still offer the same guideline-based, evidence medicine-based medical care, but you can't change the people and the people who choose to be here.
Virginia Garcia is the heart and soul of this organization. The people that we continue to serve are like Virginia Garcia. Perhaps their circumstances are a little bit different, but they continue to have many of the same challenges that her family faced. And I believe that as we continue to grow and to provide services to the larger community, she's kind of like our North Star. Her suffering and barriers that her family faced, we must continue to remember as we continue to grow and serve the community.